Chapter 15 starts looking at our blood. Chapter 15 starts looking at blood cultures, arterial and IV, and special collection procedures. So we'll start with blood cultures. They're collected from patients who have fevers of unknown origin. So for example, if the patient were to spike a fever after surgery, they want to find out the bacteria that caused that spike in a fever. During the course of bacterial infection, bacteremia or septicemia may result. Blood cultures aid in identifying the specific bacterial microorganism causing the infection. So the difference is, the type of collection tubes used must contain culture media that enable bacteria to grow under laboratory conditions. The timing and number of blood cultures obtained must be clearly indicated. So what is the order of draw and how many sets? I apologize. The order of draw for blood cultures, these would come first. These would be our sterile. Generally, the doctor will order blood cultures times 2. So we would actually draw 2 sets of an aerobic and anaerobic blood culture bottle, unless the doctor indicates otherwise. Site preparation. Your book goes over 1 site prep. I'm going to go over 2 because of the fact that in the hospital field there is 2 different types of prep. We could use chlorhexidine or iodine to clean the site. Site prep 1 is to scrub the site of the venipuncture with 70% alcohol for 60 seconds. Then we scrub with chlorhexidine gluconate swab for at least 30 seconds and initially place the cleaning swab at the site of the needle insertion and then move it outward in concentric circles in a diameter, so it would be like creating a circle going like this. Site prep 2 is to use the chlorhexidine swab stick, which has alcohol and chlorhexidine built into one swab, and a back and forth vigorous scrub for 2 minutes and then allow to dry for 90 seconds. So we would do 1 minute on one side of the swab, we'd flip the swab and do a minute on the other side and then let it dry for 90. Again, this is a combination of 70% alcohol and chlorhexidine in one swab, and this is primarily what's used. We also use iodine as well. This is the combo swab. The chlorhexidine and alcohol are built in to the same swab. In your book, if you want to reference on page 475, site preparation for blood culture collection, it goes over site prep 1 in detail. So how much blood? So if the amount of blood collected is only 3 ml or less, we're going to place the entire amount in the aerobic bottle. For infants and small children, 1 to 5 ml of blood can usually be collected for bacterial culture. Patients over 81 pounds need to collect 20 ml of blood. That's 10 ml per bottle. 2 sets are ordered, so we would have a total of 40 ml. Specimen labeling is just a little bit different when we do blood cultures. The additional information you'll need to provide on blood culture bottles is what set. So is it set 1 of 1, 1 of 2? That indicates to our labs, are we drawing 1 or 2 sets? Then we also need to indicate which arm or hand we drew them from so that we know we're collecting them from 2 different sites. Ideally, we want to collect from 2 different sites because we don't know where this bacteria might be. So we want to make sure to get a good range. Blood cultures are delivered to what department? They're going to go to microbiology. They are then placed in this kind of incubator for 3 days. They are then, it's allowing them to grow. And then they actually will swab it out in a blood agar plate that looks like this, which then they can test the individual dots or colonies. They can test those colonies to determine what bacteria this is and then what would be the suitable antibiotic to give the patient to rid them of that particular bacteria. Blood cultures are really important in the hospital setting because it provides us a lot of information, but there is estimated between 20 and 50% of people who die from various types of undiagnosed septicemia. So it's something we need to be mindful of. The other thing too your book's going to go over is safety syringe blood culture collection. And then also too how to collect using a butterfly assembly kit, using evacuators. So again, this lab will be covered when we return to class. However, I would like you to review on page 485 possible interfering factors, as those are really important, along with the clinical alerts on 483, because there's a lot of interfering factors that could prevent us from getting a quality sample. I will read you one of those. For example, the anaerobic blood culture bottle must be inoculated first in all procedures except for when we're collecting via the butterfly assembly method, because injection of air into the anaerobic bottle can cause the death of some of those microorganisms and result in a false negative culture. So we're going to show you both props, one with the butterfly collection set and then one with the butterfly syringe. I will also have a detailed chart that goes over what bottle's going to go first, and I'll put that under the instructional videos. Okay. So again, we're going to have a detailed lab on this when we return to class. So this is just giving an overview. Again, for an adult patient, we're going to collect 20 mLs, 10 mLs per bottle for a total of 4 bottles. And the other thing to be aware of is that we actually will never do a direct draw, so direct straight needle to blood culture bottle, only because the culture media in the bottom could actually get back into our patient. Next, we're going to cover GTT and lactose tolerance test. GTT is an effective diagnostic tool for patients who have symptoms suggesting problems in carbohydrate metabolism, such as diabetes. So the instructions that we will provide the patient is that we ask them to eat a normal balanced meal for at least 3 days before the test, fast for 8 hours, and drink water but not tea, coffee, or any other beverages. Do not smoke, chew tobacco, or chew gum prior to the test. Your book doesn't break down the various GTTs that are available. I do, just so that, because we see it in the lab quite frequently. So there's the 1-hour glucose tolerance test. The patient drinks a standard dose of glucose, 50 grams. The patient must start and finish the drink within 5 minutes. We encourage water intake throughout the procedure depending on policies of that particular lab, and each specimen is analyzed for its glucose content. So we would basically do a point of care test glucose to see where the patient's baseline glucose is before we give them the drink, because if it's too high, we won't give them the drink at all. We'll give them the 50-gram glucose load, and then in 1 hour, we draw the blood for glucose analysis. There's the 2-hour GTT. This is done 2 different ways. There's postprandial. This is used to screen patients for diabetes. The day of the test, the patient should eat a breakfast, and it's a glucose load of orange juice, cereal with sugar, toast, and milk to provide an approximate equivalent of 75 to 100 grams of glucose. The blood specimen is taken 2 hours after the patient finishes eating breakfast, and the glucose level is then determined. The physician can decide whether further carbohydrate metabolism testing, such as a GTT, is needed. There's also the modified oral. So after fasting, glucose specimen is collected from the patient. So again, doing that point of care glucose. The patient is then given a 75 gram of glucose, and another blood specimen is collected at 2 hours after the patient has taken the glucose drink. Encourage water intake during the procedure if it is allowed. So that would be this. So we have to be very careful about which load of glucose we give depending upon the test. Okay, so this just gives an idea of diabetes curve, severe, abnormal, mild. There's different reference ranges per test. We're going to go over hidden sugars and diet in just a minute. Then there's the 3 hours. So if the patient were to be pregnant and fails the 1-hour glucose test, they would do a 3-hour GTT. So this would be, we'd collect 4 samples. So you're going to obtain a fasting blood specimen, blood draw. The results are normal, then the patient can be given a standard load of 100 grams of glucose. And then we're going to obtain blood and urine samples at intervals of 1 hour, 2 hours, and 3 hour period. Each specimen is then analyzed for glucose content. If the patient fails this glucose test, they will go on a diabetic diet for gestational diabetes. The 3 hour glucose tolerance test, the patient does need to stay at the facility to obtain all the samples. Okay, I'm going to go back to the 2 hour hidden sugars, just kind of more of a side note. These are some interesting hidden sugar facts. So Burger King's French toast sticks, for example, have 25 grams of sugar. The oatmeal with brown sugar at McDonald's has 32 grams of sugar. Cranberry orange scone has 34 grams of sugar at Starbucks. A little individual pudding cup has 52 grams of sugar. And a single 16-ounce Dr. Pepper is more than twice the proposed recommended amount at 54 grams. And then a large Frappuccino from like Starbucks or McDonald's has 69 grams of sugar. So kind of hidden sugars we're unaware of that we might be drinking. Please be aware that this is used for screening. So this is to determine whether the patient is diabetic or not. And then the doctor will make other determinations on future diet and how to regulate and modify and test for it. Okay. The GTT is also a really great test because it gives an idea of what the patient's baseline might be too. Please be aware that we ask the patient that during the GTT test that they do not exercise, excessively run, because we want the glucose to naturally break down how it would normally break down over a course of a day or the course of time period that we're testing the patient for. The other test that they might use is what's called a Hemoglobin A1c, which determines a 3-month average of what the glucose levels are at. Is just another test to test for diabetes to help monitor it. Blood test and non-invasive. So the lactose tolerance test, it's difficulty in digesting lactose. It's a milk sugar. So the normal lactose digestion is shown here. So lactose turns to lactase, which turns to glucose and galactose. In someone who's intolerant, that lactase is missing. So it causes a bacteria ferments in water and then causes irrational caused acids and gases, which cause a lot of abdominal discomfort. There is a blood test. Gives 50 grams of lactose to the patient, the venipuncture collection on baseline. So they're going to draw specimens at 5 minutes, 10, 30, 60, 90, and 120 for plasma glucose levels. If the patient is intolerant to lactose, his or her blood glucose level will increase by no more than 20 milligrams per deciliter from the fasting sample level. Then there's the non-invasive method. This is using the breath hydrogen test. It does not involve the collection of blood, and the breath samples are collected as the patient exhales. The exhaled gases are analyzed for hydrogen. The measures the ability of a person's intestines to digest lactose. So if there's an increased amount of hydrogen, that tells the doctor that the patient might have difficulty because of that extra gas that's produced. And it is used to diagnose a deficiency of intestinal lactase, which would be cause an issue with the patient being able to break down like milk sugars, ice cream, milk, some types of cheese. So it's really important that during this, especially if we're doing the blood test, since we're giving the patient lactose, that there's a bathroom nearby just in case the patient gets sick. Okay. Again, the GTT test, I just want to reiterate from your textbook, is and want you to view its charts, box number 15/1. It gives a patient sample patient information card, which gives you an idea of the breakdown of how the glucose test is done and what these patients' results might be. It also gives you an idea of how much sugar might be in and carbohydrates and certain things. Again, the test results are interpreted then by the physician. This concludes part 1 of chapter 15. Please view part 2 of chapter 15 to continue with this lecture.